Sildenafil works in erectile dysfunction. Sildenafil is one of the drugs well known by the brand Viagra, which is used to treat the erectile dysfunction. And sildenafil can also be given in another brand Revatio, which is used to treat the pulmonary hypertension. Now in this video we are going to see how this sildenafil is useful in the treatment of the erectile dysfunction. Erectile tissue is controlled by the autonomic nervous system, and parasympathetic system produce erection of the erectile tissue. Whereas sympathetic system is going to produce a quite opposite effect, it produces ejaculation. Now this erection is a vasodilatory response that is caused by parasympathetic system, and ejaculation is a vasoconstrictory response which is produced by sympathetic system. So here the erection of the erectile tissue is mediated by parasympathetic system by vasodilatation. How it can produce a vasodilatation? Parasympathetic system is going to act through the cholinergic receptors, and these cholinergic receptors release one of the mediator, nitric oxide. Now this nitric oxide is called as non-adrenergic non-cholinergic mediator. That means this mediator is neither related to the adrenergic system nor cholinergic system, but it is released by the cholinergic system into the endothelium. Now this nitric oxide, which is released into the endothelium, then acts on the vascular smooth muscle to produce the vasodilatation. Now let us see what is the mechanism behind the penile erection. So whenever there is a sexual stimulation, it stimulates the neurons, and these neurons are going to release the important mediator, nitric oxide. Now this nitric oxide can also be released from the endothelium. Just we have seen that parasympathetic system can release the nitric oxide from the endothelium. Now this nitric oxide is responsible for the penile erection. This nitric oxide increases the cyclic GMP, thereby it acts on the vascular smooth muscle within the erectile tissue, which brings the vasodilatation and erection of the erectile tissue. Now let us see what is the role of the phosphodiesterase type 5 enzyme in the erection process. So corpus cavernosum is the important mass of this erectile tissue, which is responsible for the erection process. Neurons can release the important mediator, nitric oxide, into this corpus cavernosum when there is a sexual stimulation, and endothelium can also release this nitric oxide into this corpus cavernosum. Now this released nitric oxide then stimulates the one of the important enzyme, guanyl cyclase enzyme, GC. This guanyl cyclase enzyme, when it is activated, it will convert the GTP into the cyclic GMP. So now the cyclic GMP is the one of the important secondary messenger that is released through the stimulation of the nitric oxide. This cyclic GMP is then going to stimulate the one of a family of enzymes, protein kinase G. This protein kinase G can control the calcium permeability into the corpus cavernosum, and it can inhibit the calcium entry within the muscle. Now when there is no calcium is going to enter into this corpus cavernosum, this causes the inhibition of the contraction, which results in the relaxation in the corpus cavernosum. And when this muscle is going to be relaxed, there is an increased blood flow, which leads to the erection of the erectile tissue. Now what is the role of this phosphodiesterase type 5 enzyme? The important messenger here is the cyclic GMP, which leads to the relaxation of the smooth muscle, and this cyclic GMP can be metabolized into the GMP by one of the important enzyme, phosphodiesterase type 5 enzyme. This enzyme is more abundant in the corpus cavernosum, which is inhibited by one of the drug, sildenafil. So sildenafil inhibits the metabolism of the cyclic GMP into the GMP, thereby it increases the cyclic GMP levels within the corpus cavernosum. Because of this action of sildenafil, cyclic GMP levels are going to increase, which results in the more relaxation and more erection of the erectile tissue. So sildenafil causes the smooth muscle relaxation and increase the blood flow into the erectile tissue, which results in the erection of the erectile tissue. What are the side effects of the sildenafil? So side effects include dizziness, hypotension, headache and flushing. And you can observe that all these side effects are related with the vasodilatory response of the sildenafil. So sildenafil is simply a smooth muscle relaxant as well as a vasodilator. Thereby it produces the vasodilatory effects like dizziness, hypotension, headache and flushing. And another important side effect of concern is the priapism. It is a condition where there is a pain on erection because this drug causes the vasodilatation and erection. On prolonged erection, it produces some pain in the erectile tissue. And finally, the sildenafil can also produce the visual changes. So it can cause some blurred vision in the patient, and even it can cause some loss of discrimination of color. Particularly, the patient cannot discriminate the blue and green color when this drug is going to be used. So these are the few of the side effects of the sildenafil. And as the sildenafil is acting as a vasodilator, it can increase the hypotension and it can also precipitate any cardiovascular problems in the susceptible patients. So if a patient is already having any conditions like cardiovascular problems or liver failure, renal failure, and particularly in the cardiovascular problems, this drug is produce a hypotension and can increase the angina because of decreased blood supply to the heart. And this drug is given to produce the erection in the patients with the erectile dysfunction, and it is taken 4 hours before the sexual intercourse. So that's about the sildenafil, which is widely known as Viagra and used to treat the erectile dysfunction.